Are you worried about possible signs of autism? Today, I am covering the top 10 possible signs of autism. They also could be possible signs of ADHD or speech delay. I'm covering the top 10 signs as I outline in chapter 2 of my newest book, Turn Autism Around, an action guide for parents of young children with early signs of autism. Chapter 2 is it autism, ADHD, or just a speech delay? And I go over the top 10 signs. I'm going to cover them today. Also, if you want to get chapter 1 for free, listen to chapter 2 for free, which I'm going to cover today, and get all the free book resources, you can do that at turnautismaround.com or check the link in the show notes. So let's get to the 10 possible signs of autism now. So we're going to cover today things that are in chapter 2 of my book. And these are not, the 10 ultimate signs of autism. These are some of the signs that could indicate that your child might have a developmental delay, might have a language disorder, might go on to get a diagnosis of ADHD or autism, or maybe some of these kids are showing sensory issues and social delays, and they're going to end up to be gifted with high IQ. I've seen lots of kids who have autism and are gifted, or have ADHD and they get a diagnosis of autism. So one thing I've learned over the past 2 decades plus is that it's not very clear. There's a big gray area when you're talking about delays and diagnoses and multiple diagnoses. So I do want you to know that these are just possible signs. I know many of you have older children with autism, and you might feel like I'm focusing a lot on younger kids. My new book, Turn Autism Around, is certainly focused on those kids ages 1 to 5 with or without a diagnosis, but showing signs of autism. And I am focusing more so on the younger kids. I still have lots of episodes and lots of things for older kids and even adults with autism. But my mission is really to get to those parents who might be like me in denial that there's anything wrong. And that's the way I was when Lucas first started showing signs of autism. So I want to help parents and early intervention providers really tackle the earliest signs of any delays to help kids get back on track as much as possible, to help kids talk more, tantrum less frequently, and improve eating, sleeping, potty training, and so much more. So before I go over, the first few signs, I do want to say that I've done a lot of work in this area. They're my number one top rated viewed YouTube video is called Is It Speech Delay or Autism? And that has been viewed by over 1 million people. And so we'll link that in the show notes. That has basically the signs of speech delay versus autism. We're going to cover how you might tell, but I am not qualified to actually diagnose autism. You need to be a certain kind of physician or psychologist with training. I do have a lot of training, but as a registered nurse, I am not in a position where I can diagnose, but I can help parents and professionals really look at the signs. And another big thing I've learned over the years is it doesn't matter if it's autism or if it's going to turn out to be something else or nothing at all, that these techniques, these proven techniques, and my 4-step Turn Autism Around approach actually works no matter what. We did a recent interview with a mom who happens to be a behavior analyst, and she has a son with Down syndrome. And I know the procedures that I talk about in both of my books and both of my online courses work no matter what. So we can link that in the show notes. We can also link a video blog on the MChat and the ADOS tests. These are screening tools for autism, which can really point you in the right direction. And we can also link a couple shows that we did with surrounding COVID isolation and how sometimes that can really affect kids' language and their social abilities. Okay, number one, the first sign that is in chapter 2 of my book is pointing. And I say, even though I have a nursing background and I had no idea before Lucas was diagnosed with autism that pointing with your index finger, not reaching out with your whole hand, but pointing with your index finger by 15 months and 18 months at the latest is a very important milestone. So if I look at a little 18-month-old or 2-year-old who is very speech delayed, and one is pointing and one is understanding the world around him and pointing with their index finger, and the other one is not, that pointing really is a lack of pointing is a really big red flag for autism. Not just pointing at the jar of cookies because I want a cookie, but also pointing at more abstract things to show you things, like pointing up at the sky to point at an airplane. Even if a child can't talk, if they can point with their index finger to show you things, that's a really good sign that there's joint attention and that the social delays are not present. So pointing is, lack of pointing by 18 months at the latest is a red flag for autism. Now, if you have a 3 or 4-year-old who's pointing, we can't really use that as, okay, they're pointing and they're 3 or 4, so they don't have autism. The pointing needs to start, after age 1, even for some kids, even before that, but, between 1 and 18 months, that pointing can't just be once in a while too. It's got to be a regular thing, at least until words really start flowing. The other thing I want to point out, no pun intended, is that even if a child can point, if they have a lot of these other signs, pointing specifically doesn't rule out the fact that it could be autism. And I use an example from a guest that I had on the podcast who's a speech pathologist. And the other thing in my courses, I teach you how to teach kids to point. I have a video blog on pointing. So it's a teachable skill. So if you work really hard on teaching pointing and they have pointing by the time of their evaluation, that doesn't mean that they're not going to get a diagnosis of autism. So it's just one of the signs. That's the important thing, is not just to look at one of these signs and latch onto it. It's got to be a few or a lot of signs, and it has to be an evaluation by somebody who can rule out or rule in autism. The number 2 sign of possible autism is speech and language delays. Not just the talking part, expressive language, but also the understanding, pointing to body parts, following directions, like simple directions, like throw this in the trash can, go get your shoes, without a lot of gestures showing kids. Touching body parts out of order. Like in this example, I tell the story of how I thought when Lucas was 3 that he could touch his body parts, and the early intervention people were like, he's not touching his body parts. Can you show us how you get him to touch his body parts? And I was like, sure. And I sang this Barney song, like first we touch our head and then our toes and then our belly and then our nose. And I was showing him at the same time. So yeah, learning things like head, shoulders, knees, and toes, and doing that's a great skill. That doesn't mean they understand touch your nose without any gestures. And so looking at both the expressive language as well as the understanding of language, or what we call receptive language, is key. But lots of kids have speech delays, just like Rachel's son Everett had major speech delays. He wasn't talking enough, but he also wasn't socializing because of COVID. And that, sometimes happens. And it could be a speech disorder such as apraxia. We've had a podcast episode on that with BCBA and SLP, Tamara Casper. On that show, we can link. Language is just so complex, but Having social language delays is the hallmark sign of having autism, but it can be a big range. And depending if you're 1.5, you're 4, you're 12, you're 18, those kind of signs of what that social language delay looks like can be extremely wide. The range is just very wide. But if you have a young child who is not talking at all, not putting words together spontaneously, there's a lot of push, I think, in the whole world about getting kids to talk in sentences, because parents and professionals know that that's a big milestone. But when you rotely teach kids to put sentences together rotely, doesn't really count for that natural, spontaneous language that they need. So that's the number 2 sign, is speech and language delays. The number 3 sign that not all kids have is excessive tantrums. And I know for Lucas, when he was a baby, an infant, toddler, preschooler, he really didn't have any major tantrums. He was a very laid back child. He would transition easily from thing to thing. And so that was confusing. Yet some children without autism can be very temperamental. And kids with language delays in general are much more at risk for more severe problem behaviors. Kids can have self-injurious behavior where they scratch themselves, they hit themselves, they bang their head on hard surfaces. They can have aggression towards others where they're scratching, biting, kicking. And they can have property destruction where they're overturning chairs. And this is what I'm talking about when I say tantrums. Anything that's causing injury, of course, is more of a major problem behaviors, but kids can also have other more minor problem behaviors, which gets into some of the other signs. The next sign, possible sign of autism early on, would be not responding to a child's name. So when you call a name, the child not responding. This was a big sign for Lucas. We actually ruled out him having being deaf or being hard of hearing, but he'd have selective hearing. So he might not respond to Lucas, but he would respond if he heard the Barney's theme song, or he heard the Pennsylvania Lottery song going on the TV and he was in another room, he would run in. So there's easy ways where you can test a child's hearing. Of course, getting standard hearing tests is also a very good idea. Just like pointing, though, we can teach kids to respond to their name. I have a video blog on that. We can link that in the show notes as well. And the key with, if a child is not responding to their name, is not to overuse their name, especially when saying no or giving a demand. So I see this in schools a lot, or I used to see it in schools when I was in schools consulting, is the teacher would say, Johnny, touch your nose. Johnny, come here. Johnny, stand up. And every time you're using a child's name and a demand, it's actually unpairing the name and making it more aversive. So we stop using the child's name, especially when saying no or giving a demand, and then we pair up the name with positive reinforcement. Okay, the next sign we have here is delayed playing behaviors. When you see a young child with early signs of autism playing, it's often repetitive. One of my clients used to stick bottles, straws in a bottle over and over again. Some of my clients used to build blocks repetitively over and over again, line things up, move things a certain way. They're not incorporating language. They're not playing with a wide variety of toys. They're not generalizing with a lot of variety of toys. And they're not developing pretend play, which surprisingly comes along in development very early on. And we're starting even before 18 months of age in many cases. So that pretend play is very much missing. And that joy and attention of wanting to share in experiences. So those are some playing behaviors that are often delayed in kids with autism. The next sign is repetitive behaviors. A child with autism may flap their hands in front of their face, again, lining up objects, spinning wheels on cars. And some of the repetitive behaviors can actually be major problem behaviors. I had a client once early on who was only 2, and he was banging his head on hard and soft surfaces throughout the day. He was kind of very understimulated, and to get stimulation, he would bang his head. And the reason I was consulted early on when he was only 2, through the early intervention program in my county, is because he was banging so much that he actually had an open lesion on his back of his head. So upon assessment, he was going to a home daycare situation, and I asked the provider how much he was banging out of the 9 hours that the child was there. And the provider said about 3 hours a day he was banging out of the 9 hours, and that's what caused the open area. So we came up with interventions right away. The child was being placed in a pack and play to take 2 naps. He was banging before he went to sleeping, then he was waking up, he was banging again. He had a high chair situation going on, so he was banging his head while he was eating. So 2 quick interventions to get that repetitive behavior down and get the self-injurious behavior gone is we stopped 2 naps a day, and we kind of made it a rule, like he'd have to be really tired to take his nap, so he wouldn't have a lot of banging before he fell asleep. And as soon as he got up, the child care provider needed to pick him up. Also, we changed from a high chair to a booster seat so that we didn't have so much banging, but the child needed major engagement, major therapy, and we got that in place. And we got the head banging pretty much gone, at least for that function of just stimulating his brain, which was pretty scary. So the repetitive behaviors can be very mild, like lining things up, or they can be major, like head banging. Okay, the next early sign is sameness. An insistence on sameness might be an indicator of autism. It might not be, though, because we all like routines, and we all like to kind of park in the same spot at the mall and go the same way. For kids that end up being on the spectrum, this can be pretty extreme. They may tantrum if you're going in a different direction in the car, or want to walk a different way in the mall, or want to go just grab a couple things at the grocery store and not go through the regular routine. They may not like to wear different clothing or eat different foods. And so this can be kids can get very rigid very quickly. So sameness is the next sign. Okay, the next sign is sensory issues. And kids with sensory processing disorder often get missed for autism. And we, just like everything else, it's sensory issues, sensory defensiveness, sensory seeking, sensory avoiding is on a spectrum. I know for some people, my husband and my typically developing son, they would score more, they have more sensory issues than even Lucas or than I do. You can't expect everybody just to be kind of Joe normal in terms of sensory issues. And when I say sensory issues, like picky eating, don't like the look of foods, have hearing sensitivity. Lucas has a lot of hearing sensitivity, so he wears headphones a lot. And he even did when he was younger as well. And some kids don't like to be touched, are bothered by tags in their clothing. This is all falling under the sensory issue sign. Some kids are hyper sensitive. They are sensory seeking. They like to jump. They like to run into walls. They like to squish themselves into the sofa cushions. And then some kids are sensory avoidant. They don't want to be touched. They don't like the tags. And then there's kids, most of us, in some areas we're sensory seeking, in some areas we're sensory avoidant. That's normal, but our kids that end up with a diagnosis of autism tend to have more sensory issues in general. Okay, we're getting through these very quickly. We only have 2 more signs. Number 9 is motor delays and toe walking. So this isn't really, I mean, if you look up signs of autism, rarely do people talk about motor delays and toe walking, but I wanted to put that in because over the past 2 decades since I've been in the autism world, this has really changed. In the past, when Lucas was diagnosed, there was thought to be no motor delays in children with autism. But over time, there have been studies that have shown that kids on the spectrum tend to walk later than typically developing kids. So Lucas walked at 14 months. Spencer walked at 11 months. Spencer is not on the spectrum. Toe walking is also can be a sign of autism. So we have kids, especially if they're barefoot, will walk on their toes. And there's all kinds of debate about why that is. And toe walking doesn't have to be autism. I've seen typically developing kids toe walk. I've seen kids with other motor issues, such as cerebral palsy and things like that, toe walk. It definitely can look like motor delays, motor planning problems. A number of my clients had physical therapy, occupational therapy in place before or after I got there. One of my clients, Cody, and I talk about him in my book, and his mom was on the podcast a couple of years ago, actually. He started at the age of 1 with physical therapy and occupational therapy, and he had motor issues. He didn't walk until he was 2. Mom actually thought he might have cerebral palsy. And so when she got the diagnosis of autism, she was a little surprised. Cody did go on then when he was older, maybe 7 or 8, he got a diagnosis of mild cerebral palsy on top of autism. So it doesn't mean that if you have some physical delays that it is autism. There have been studies that to show that kids do tend to have more motor delays and motor planning problems if they are on the spectrum. But I think Cody's case illustrates that it could be something else, more motor related. But if you couple all these signs together, he had speech delays, he had lack of pointing, he had sameness issues, he had excessive tantrums, he had sensory issues, and he had motor delays. So it's not just like you can just hang on to one thing and say it's definitely autism or it's not autism. In a lot of ways, it doesn't really matter. And our final sign number 10, is poor imitation abilities. I didn't realize early on how important imitation is to typical development. But if you think about babies babbling back and playing patty cake and doing those baby kind of joint attention skills with an adult, kids on the spectrum tend to get off track. Some kids just never are on track. Some kids like Lucas have some regression, kind of stop pointing, stop waving, stop the sing-songy back and forth. And they lose their imitation skills if they ever had them. And they need to be taught again, just like pointing, responding to name, and language delays. We can teach imitation. Actually, it's one of the very first skills I teach because you can get a lot of bang for your buck in terms of teaching imitation so that kids do tend to improve with their play skills, improve with their language abilities, improve with touching body parts and following directions. If you can have them imitate, you can change a lot of their world. So those are the 10 signs that are documented in chapter 2 of my book, Turn Autism Around. Let's just review them quickly. Sign 1 is lack of pointing by 18 months at the latest. Sign number 2 is speech and language delays. Don't just look at talking or the expressive part, also look at receptive language, which is really important. Sign number 3, excessive tantrums can happen with many of our kids, especially if they have severe language problems, because if you can't communicate, you tend to have more tantrums. Sign number 4, not responding to name. Sign 5 is playing behaviors that are delayed. Sign 6 is repetitive behaviors. 7 is sameness, insistence on routines and doing the same thing over and over again. 8 is sensory issues. 9, motor delays and toe walking. And the last sign number 10, imitation. So I hope you enjoyed that. If you did, I would love it if you would get a hold of my book. You can actually read the first chapter for free and listen to the Audible of me reading the second chapter just by going to turnautismaround.com. You can also get all the free book resources, the assessment form, filled out sample assessment form, the planning form, the feeding grid, where you can literally take a piece of loose leaf and plot out what your child loves, what your child likes sometimes in terms of food and drink, and then what's really difficult. You can make a plan right away based on the information in my book and the book resources. So turnautismaround.com to get all your free book resources and get started listening to chapter 2, which we just reviewed with me reading it just for free at turnautismaround.com. I hope you enjoyed this brief solo show on the 10 possible signs of autism. If you did, would love it if you would leave a review on Apple Podcasts or wherever you're listening. That helps us spread the word to get more parents and professionals into our world, learning really positive strategies to increase talking, decrease tantrums, and improve eating, sleeping, potty training, and so much more. So that's it for this week. Hope to you tune in next week for another episode of Turn Autism Around. Have a good one.